This is the last recording for Chapter 34, Sudden Infant Death Syndrome. The death of an infant or young child, called Sudden Infant Death Syndrome, SIDS, when after a complete autopsy the death still remains unexplained. About 3,500 infants die of SIDS annually. The American Academy of Pediatrics recommends that a baby be placed on his or her back on a firm mattress in a crib that is free of bumpers, blankets, and toys. The CDC recommends having the baby sleep in the same room but not the same bed, chair, or sofa as an adult. Although it's impossible to predict SIDS, risk factors include mother younger than age 20, mother smoke during pregnancy, and low birth weight. Death as the result of SIDS can occur at any time of day. You will be faced with 3 tasks: assessment of the scene, assessment and management of the patient, communication and support of the family. Patient assessment and management. An infant who's been a victim of SIDS can be pale or blue, not breathing, and unresponsive. Other causes for such conditions can include the following: overwhelming infection, child abuse, airway obstruction from a foreign object or as the result of an infection, meningitis, accidental or intentional poisoning, hypoglycemia, low blood glucose level, congenital metabolic defects. Begin with the assessment of the ABCs. Provide interventions as necessary. Depending on how much time has passed, patient may show signs of postmortem changes, including stiffening of the body called rigor mortis, dependent lividity, which is pooling of the blood in the lower parts of the body, or those that are in contact with the floor or bed. If the child shows these signs, in some EMS systems, a victim of SIDS may be declared dead on the scene. Deciding whether or not to start CPR with the child in rigor mortis or dependent lividity can be difficult. Family members may consider anything less to be withholding critical care. The best solution may be to begin CPR and transport the child and family to the nearest ED. There's no signs of postmortem changes. Begin CPR immediately. As you assess the patient, pay special attention to any marks or bruises on the child before performing any procedure. Note any intervention that was done before your arrival. Scene assessment. Carefully inspect the environment, noting the condition of the scene where the infant was found. Your assessment of the scene should concentrate on the following: signs of illness, including medications, humidifiers, or thermometers, the general condition of the house, signs of poor hygiene, family interaction. Don't allow yourself to become judgmental about family interactions at this time. Do note and report any behavior that is clearly not within the acceptable range, such as physical or verbal abuse. The site where the infant was discovered. Note all items in the infant's crib or bed, including all pillows, stuffed animals, toys, and small objects. Communication and support of the family after the death of a child. The sudden death of an infant is a devastating event for a family. It also tends to invoke strong emotional responses among healthcare providers. Part of your job at this point is to allow the family to express their grief. In addition to any medical treatment the child may require, you must be prepared to offer the family a high level of empathy and understanding. The family may want you to initiate resuscitation efforts, which may or may not conflict with your EMS protocols. Always introduce yourself to the child's parents or caregivers. Ask about the child's date of birth and medical history. Do not in any case speculate on the cause of the child's um, death. The family will want to see the child and should be asked whether they want to hold the child and say goodbye. The following interventions are helpful when caring for the family at this time. Learn and use the child's name rather than the impersonal your child. Speak to the family members at eye level and maintain good eye contact with them. Use the word dead or died when informing the family of the child's death. Euphemisms such as passed away or gone are ineffective. Acknowledge the family's feelings. I know this is devastating for you, but never say I know how you feel. Even if you've experienced a similar event, the statement will anger many people. Offer to call other family members or clergy if the family wishes. Keep any instructions short, simple, and basic. Emotional distress may limit their ability to process information. Ask each adult family member individually whether he or she wants to hold the child. Wrap the dead child in a blanket as you would if he or she were alive, and stay with family members while they hold the child. Ask them not to remove tubes or other equipment that was used in any attempted resuscitation. Each individual and each culture expresses grief in a different way. Some will require intervention. Most caregivers feel directly responsible for the death of a child. This does not mean they were actually responsible. Although you should keep the possibility of neglect or abuse in your mind, your role is not that of the investigator. Further inquiry is the responsibility of law enforcement. Some EMS systems arrange for home visits after a child death so that EMS providers and family members can come to some sort of closure. You need special training for such visits. A child's death may be very stressful. Take time before going back to the job. Talk with other EMS colleagues. Be alert for signs of PTSD in yourself or others, which results in nightmares, restlessness, difficulty sleeping, lack of appetite. Consider the need for any professional help or signs that would occur. Apparent life-threatening events. Infants who are not breathing and who are cyanotic and unresponsive when found sometimes resume breathing and color with stimulation. These children have what's called an apparent life-threatening event, or ALTI, called near-miss SIDS in the past. Classic ALTI is characterized by a distinct change in muscle tone, choking, or gagging. After the event, the child may appear healthy and show no signs of illness or distress. You must completely and carefully assess and provide rapid transport to the ED. Pay strict attention to the airway management, assess the infant's history and environment, allow caregivers to ride in the back of the ambulance, and the physician will have to determine the cause. And this is the end of chapter 34.